As you know, if you've lived in the Chattanooga area for any length of time, we have a lot of emphasis with our healthcare on stroke prevention and treatment. Well, this month of April happens to be Minority Health Month, and we're so happy this morning to welcome Dr. Matthew Kodsi, who is the Stroke Program Director at CHI Memorial, educating us a little bit on some things that we probably already know, but some new things that we might not know. Good to see you.
Good to see you. Good morning.
It is true that we're aren't we in this, quote, stroke belt
Yes,
here?
ma'am. Yes, we are. And that has a lot to do with a number of health issues, high blood pressure, diabetes, diet issues here in the South that affect people that increase their risk for stroke.
And so here we already have this increased risk just simply by our geography. But then within our population here, minorities are at a greater risk of stroke. Am I understanding that correctly?
Yes, they are. If you look at the numbers, particularly, for example, looking at African Americans, the incidence of first stroke in African Americans is nearly double that in other racial groups.
So in recent years, when I say recent, I'll say the last maybe 10 to 15, there's been an awful lot of progress made in what you can do medically now to treat stroke within time is time. I've heard the phrase before, time is tissue.
Yes, and time is brain, we say as well.
Right, so if people can get in early, even if they've had a pretty significant stroke, there is still hope for recovery.
Absolutely, absolutely. There are things that can be done to either break up a clot that might be blocking blood flow to a part of the brain, or even going in to remove that clot that's preventing blood from getting to a part of the brain.
Okay, so since time is your best friend or your worst enemy, depending, it's really important that you know what the symptoms are that you're having a stroke so that you hurry and get to the hospital.
Absolutely.
Something we've heard for a long time is FAST.
Yes.
What does that stand for?
So FAST is face, which symbolizes the fact that someone who's having a stroke often has changes in their facial expression. They get weakness, so a droopy one side of the face. A is for arm, so weakness, particularly people think all of a sudden they can't use their arm, although leg is also important. S is for speech. So when someone's having a stroke, sometimes it will affect their speech, so it's slurred, difficult to understand. Or even if it's not slurred, people will have difficulty getting words out or even understanding words that are said to them.
Okay.
And then T, of course, for time.
Okay, now there are two others that you're adding into it. One is balance.
Yes.
The other is vision.
Yes.
I'll let you elaborate on those two things.
So now what they've done, instead of making it fast, as in act fast for stroke, it's be fast. So if you suspect a stroke, be fast. The F-A-S-T we already talked about.
Yeah.
The B for balance, and the E for eyes or vision in that sense. Now you can also say not only vision, but eye movement. So people think about vision as I've lost vision.
Right.
But if you have a stroke, you can also affect one eye and the way it moves, so you can get double vision, so sudden changes in vision, not just loss of vision.
Okay, so if you're experiencing any of these symptoms, if you're having a stroke, do you tend to have more than one of these symptoms, or can it be isolated?
It varies, and it depends on where the stroke is occurring in the brain.
Okay.
I think the key thing to keep in mind is the sudden change. So if you're walking along or doing your normal daily activities and all of a sudden you have weakness, all of a sudden your vision changes, all of a sudden you lose balance and it's not getting better, those are signs that you might be having a stroke, and those are signs that you should get yourself to an emergency room as quickly as possible.
Do strokes tend to affect people at certain ages? Are we more at an increased risk as we get older, or can you have one in your middle-age years?
So certainly age is a significant risk factor for stroke.
Okay.
And in some ways that's because the older we get, the higher the risk for having other health conditions like hypertension, diabetes, and other things that increase your risk for stroke. Now that said, someone who's had diabetes since the age of 10 and they're 35, that's 25 years of diabetes. They also are at risk for stroke.
And that's type 2 or type 1 diabetes? Does it matter which type you
So
have?
obviously the earlier onset of diabetes is more likely to be type 1. Type 2 tends to be at a higher age, starts at an older age. So you could say diabetes in itself is a risk factor no matter which type, but you're more likely to have had type 1 diabetes if it started at a younger age.
Okay, since you are focusing a bit on minority health care this month in the African American population, sickle cell anemia continues to be a problem. Does that put you at greater risk?
Absolutely it does. So sickle cell anemia is, the name comes from the fact that the blood cells in certain conditions, they change their shape and they look like a sickle And because they're not normally shaped, they can block up blood flow. They can stop up the blood vessels.
Really?
And if that happens, you can cut off blood flow to a part of the brain and have a stroke. And that's treated differently than someone who just has a clot. We actually need to dilute out those sickle-shaped cells and get normal-shaped blood cells in there to thin out the blood.
Okay, two last questions. One, do strokes tend to be a little bit genetic? So if you have a family history of stroke, should you be a little bit more proactive in your own health care?
I would say if you have a strong family history, multiple family members with stroke, your risk is certainly higher.
Okay.
But of course, then you have to say, where did those strokes come from? Was it
Right.
because there was a family history of high blood pressure?
Right.
Or family history of diabetes, something like that.
And I can't have you here and not address what nobody wants to hear if they are a smoker, but the increased risk that smoking brings.
Absolutely, there's no doubt. No doubt, smoking dramatically increases your risk, not only for stroke, but for other diseases like lung cancer, for example.
Okay, so people can access you by going to CHI Memorial's website, correct?
Yes, ma'am.
Okay, so here's the information for you to reach Dr. Kodsi. It is Stroke Awareness Month, don't forget. So if you call the number that you see there on your screen, or just simply go to memorial.org/stroke, Dr. Kodsi and the whole team of physicians there are working to keep you healthy. So good to see you.
And good to see you as well.